US President Donald Trump has issued an executive order imposing tariffs of up to 100% on certain foreign-made patented pharmaceutical products. The administration cites concerns over national security and supply chain vulnerabilities, noting that a significant portion of critical drugs and their ingredients are produced abroad. While the tariffs target patented and branded drugs, generic medicines, biosimilars, and most essential drugs are currently exempt. Notably, the administration has emphasized that this move is aimed at strengthening domestic pharmaceutical manufacturing and reducing reliance on foreign supply chains, which could be vulnerable during global disruptions. Well, what the executive order entails, let us break it down. Under the new order, companies that have signed a most favored nation pricing deal with the US government and are actively onshoring production in the United States will face no tariffs. For companies that are in the process of building US facilities but have not signed pricing agreements, a 20% tariff will apply initially, increasing to 100% after 4 years if the situation remains unchanged. The administration has given large firms 120 days and smaller firms 180 days in order to negotiate before the steep tariffs take effect. Well, the proclamation highlights that about 53% of patented pharmaceutical products sold in the US are produced overseas, while only 15% of active pharmaceutical ingredients, that is APIs, are manufactured domestically. And this reliance on foreign production, officials argue, could threaten access to life-saving medications in the event of a global supply chain disruption. Well, what will be the impact on India? Let us shed light on that. Notably, for India, the immediate implications are limited because generics, which account for the bulk of Indian pharmaceutical exports to the US, are currently exempt from tariffs. Indian firms dominate the global generic drug market, and these low-cost medicines form the backbone of India's pharmaceutical trade with the United States of America. However, the longer-term picture is more complex. Steep tariffs on patented drugs and APIs could affect Indian companies involved in contract manufacturing or supplying intermediates to multinational pharmaceutical companies. Well, firms like Dr. Reddy's Laboratories, Sun Pharma, and Biocon, which have portfolios extending beyond generics, could face pricing pressures or additional compliance costs when selling patented therapies in the US. Industry experts such as Siddharth Mithal, CEO of Biocon, have noted that while the exclusion of generics prevents immediate disruption, the broader policy signals rising protectionism, which introduces a layer of policy uncertainty for the pharmaceutical sector. Now let us break down about the global implications. Well, the US executive order also affects other countries differently. Companies in the European Union, Japan, South Korea, and Switzerland that have not signed MFN pricing or reshoring agreements will face 15% tariffs, while firms in the United Kingdom with existing agreements will face 10% duties. Well, the overarching goal of the policy is to incentivize reshoring and domestic production, encouraging pharmaceutical companies worldwide in order to establishing manufacturing and R&D facilities in the US. This could gradually reshape global supply chains and redirect future investments away from traditional production hubs like India. Well, in summary, the Donald Trump administration's executive order represents a significant push towards self-sufficiency in pharmaceutical production. And for India, the short-term effects are cushioned by the generics exemption, but long-term implications could influence contract manufacturing, especially drugs and investment flows. Globally, the move signals a shift towards domestic production, reshaping supply chains and investment priorities in the pharmaceutical sector. That's all for now. Stay tuned to the Savera for more updates. Do like, comment, and subscribe to the channel.